Dr. Henry, much has been made of something you said earlier this week where you asked British Columbians to do more. And we've heard from many people who have said, if you want them to do more, we need more transparency from the government about exactly where transmission is happening and how this virus is spreading. Can you give that information to people so they can do their best?
Yeah, so when I talk about doing more, I'm talking about where we are right now. We're in this long marathon, and we know that we get most tired near the end. This is a very difficult time. And when I talk about doing more, for many of us, the vast majority of us who are doing our best right now, it's about reaching out and supporting each other and supporting those we know who are bending the rules or feel those rules don't belong to them or don't apply to them, reaching out and bringing them along too. And for people who feel these rules don't belong to them, I'm talking to you too. It's never too late to rejoin our fight, our challenge here to get through this together in the next few weeks and months.
And 1 year later, we are certainly not where we would like to be. Our daily case counts are in the 400s or 500s. They have, as you said, plateaued. And when he was asked by reporters yesterday if there's anything we should have done differently or done sooner, Premier John Horgan said yes and yes. What do you think could have been done differently or done sooner?
I think challenges are that it's easy to look back and say we should have known this or we should have known that. If I think back on some of the things, I would have probably tried to come in with more stricter restrictions in October when we were actually doing okay. But we had a rapid increase. It's all about human nature as well. So it is very challenging, and I think there'll be lots of time to go through the woulda, shouldas in detail in the future.
You have said that we need to live with this virus, and so BC has not had full lockdowns or curfews that we've seen in other provinces, but instead you've been asking workplaces to have safety plans, that people limit gatherings, keep their bubbles small. Is this now the time for the province to be taking a tougher stance?
I think we've done well with trying to find that balance of being able to keep as much as we can going. We know how important it is to have that economic lifeline as well for many, many businesses. It's not health or business; it's both. We need both to get through this, and we are also very aware of the unintended consequences of some of the measures that we've taken in public health. And that's why we are focusing on the important things like keeping schools open. And so these are the things that we're trying to focus on. It does mean that we have probably more cases than I'm comfortable with right now. But it's also a reflection of how we've been able to manage as a society here in BC by being resilient, being adaptable. And those COVID safety plans are incredibly important, and we need to step up those right now. It's easy to slip after this time. We're tired. We want it to be over. But right now, we have to focus even more. There's an end in sight.
We have seen modeling from SFU this week showing us what could happen if the new, more transmissible variants of the virus take hold. Are we doing enough right now to prevent that from happening?
Yeah, that there's been lots of challenges around travel in particular, and that's how these new variants become introduced. And we have been pushing our federal government to take stronger measures. We have this required 14-day quarantine, but it's not always monitored in the way that I believe it should. We need to add more testing at our airports, at our border crossings to better understand people who are coming in and out of the province. But it also means that we need to take the responsibility right now to not travel within the province, because that is part of what we're seeing. We're seeing that people are going to visit friends. We see that people are going to, the ski hill, but it's not the ski hill that's the problem. It's the parties that are happening in and around that, or the gatherings that are happening. So we need to step back from that right now as well.
When you talk about ski hills, you're very specific in the recommendations that have been made when it comes to snow sports. You say if you live in the lower mainland, ski at the three local hills. And yes, skiing itself may not be a high risk activity, but they're not necessarily having parties. They're going to restaurants and bars afterward, which we are told, and you are continually telling us, are abiding by COVID protocols. And yet we're seeing exposures now in 6 locations in Whistler. Do we need to change something there?
Yeah, and absolutely. And you will have noted that a number of bars and restaurants have not been following the rules, and they've been closed down by public health, and that will continue. Right now, I'm asking people not to go out to restaurants except with your household, with your close bubble. And when we do that, it works and it's safe. It's people who are pushing the rules that are the challenge right now.
This has been all about treading a line between controlling the spread of the virus and trying to maintain some semblance of normal life. Tell me about what goes into making those decisions, finding that balance. Who do you talk to when you need to do that?
Well, I am very cognizant that I'm the voice and the face of a large group of people that we consult with regularly. My public health colleagues, we have medical health officers around the province. We talk a lot with people like Dr. Cochin from SFU, the people who do the modeling. And really, we have a number of different groups that I speak with every day. I speak with my colleagues across the country and around the world, and we all look at what are the things that we need to do, what are the things that are working or not working, and trying to find, as you say, that balance and providing the best advice we can to government. And it is the things that we learn that are so important, and I mentioned this earlier, that we've looked at what are the consequences on society of the things that we're doing.
And how loud is the voice at the table says we need to keep businesses open and keep people working?
It's all very balanced. There's a very large group that says lock everything down and curfews and no travel and nobody move anywhere. There's also people who are saying we've gone way too far and that everything should be open and all of this is just a hoax. The dilemma that I have is you can never do enough. The ethical principles that we try and follow are doing just enough to find that balance, but it's very challenging. And if we don't do enough, virus can take off. And that has impacts on the economy. It has impacts on our lives. If we do too much, we're affecting people's lives and the economy as well. So finding just right is probably not possible. And so we've erred on the side of doing a little bit too much, but trying not to go too far. Because I believe that the biggest risk is if we have too much transmission of this virus.
Thank you very much for your time this morning. We appreciate it.
Thank you.